Dr. Gonzaga and Andabati, thank you for joining us this evening. And we want to start by understanding what happens in this place here, what scientists refer to as a cryobank.
We store both the sperms, we store eggs, but we also do store other things like embryos after the eggs have been fertilized, but we also store some tissues from the ovary for those who need, and also some tissues from the sperms. So usually the specific lineup depends on the situation, but by and large, there has to be an indication. So they go through clinical evaluation. For those who want to store, for example, sperms, there's usually some indication. Either the man is going to undergo cancer treatment, or he is thinking about doing his fertility life or reproductive life later in future, so he wants to store for future use, or he's going to undergo some operation, like operations on the prostate, or he's going for what he considers a dangerous mission, like to go and work in the mines for a long time, or he's going to work in a chemical factory, or he's going to a war zone, like for the soldiers. So the person comes, we do the evaluation, we do the general health check, and then they provide the sperm, and we first check to ensure that their sperms are in a good state.
Take us through the process. How do these samples come into this place? For example, if you're picking the sperm sample or even the egg, what does it look like?
Yeah, so the entire setup in this room is designed to allow a very smooth flow of the process. Now, for example, that window right up there, it connects to another room beyond, which is where we remove the eggs from. Now, when the eggs are removed from that room, we call it egg pickup room. The eggs are passed through this window, and this is where they first arrive. So here, the person called the embryologist or the laboratory specialist will look through the fluid which has the eggs and pick up those eggs. So here the eggs are raw and they are picked up. Now when they are picked up, they are washed with a clean fluid, and so all those debris are cleaned out. Then from there, they are taken here for some short incubation, just to make them recover a bit before the further steps of fertilization. Now, once they have recovered a bit, they are brought again to here, where they are either mixed with the sperms, and once they are mixed with the sperms, then they are taken to those upper incubators where fertilization occurs. Now, for the sperms, they come from the other side, the sperm processing room, that side, and when the sperms are processed in that room and they are ready, they are brought here to this desk for examination. So if the process of fertilization is that of mixing the sperm with the egg so that the egg picks the sperm that is supposed to fertilize it, they are mixed here and then taken to the incubator. But another method of fertilization is where you get the sperm and inject in each egg, and that happens on this machine. So over here you will have the egg loaded and the sperm which is already processed, and this machine, with the help of the machine, the embryologist will help to inject each egg with a sperm. And after that injection is done, then the whole injected egg, the eggs are put in these incubators for further development. Yes. So we keep them in these incubators for about 3 to 5 days, and we of course keep checking the progress.
So after collecting these materials, how do you store them? What is the process like?
For the storage, for example, when you sort out, for example, the eggs, once you've gotten the mature normal eggs, you store them. Later you warm them. Now, the mature eggs should have a very good survival rate. Like 8 or 9 out of 10 eggs should be able to survive very well and to be used successfully. So success is good. And for the sperm, it's very high because the sperms are more resilient. The cells are tiny and there are many. So usually we are almost sure that we'll get the sperms we need in future. So it's not a problem.
What are the ethics and guidelines, the principles around storage of these gametes?
Concerns are more of parentage. Who is going to be the parent of the baby that results from the usage of stored sperms, for example, donated sperms. So those are varied and they are handled according to how they are. We do have a number of guidelines, unfortunately not local ones yet. They are being developed yet for the local. We had a number of guidelines which we adopted from the European Center.
And what about the donors and those who want the service? For example, they want to access as recipients. What are the modalities you follow to ensure that you help such people?
For somebody to donate eggs or sperms, they have to be found to be suitable to do that. Now, suitability for a donor means freedom from transmittable diseases is one of the first things. We're talking about HIV, genetic diseases, and some other diseases which you can transmit to the offspring. We screen them for that. We screen for sickle cell and all this. But also we screen our donors for IQ. They have to undergo IQ test because we know there might be questions related to this, but of course who wants to have offsprings who are not very sharp? I mean, they have to go through that. They also go psychological assessment because some people, you don't want to somebody to do the donation of the eggs or the sperm with hidden motives. What is their motivation? Is it to help, or there's some other mental issues they are dealing with, which is manifesting in this offer to store?
What is the success rate of this entire process? Also, you can tell us about the cost.
Yeah, so it's actually not very prohibitive. Of course, if somebody is coming to donate eggs and sperms, they don't incur any costs. If they are donating to people, they don't incur any costs. We give them some bit of stipend. Ugandans are the best people I've seen. They are not very like money minded in that, you know. So they are willing to offer sperms and eggs at affordable things, at costs. But if somebody wants to store their own, for example, sperm, or to store the egg for future use. Now for the sperm, it is affordable because once you provide the sperms, they are processed. The process of processing is not expensive. So we end up, I think, with an approximately about 3-4 million for the process of starting. And that is enough for the first year. So imagine first year, you spend about 4 million for this beginning, and your sperms are kept. Then the subsequent years, you pay monthly fee of about 100,000. So that's about 1.2 for the entire year. Yes. So, and doesn't matter how much of your sperms you kept. Yeah, so for the sperm, it's like that. Then for the egg, because it involves the process of stimulating and getting the eggs removed and processed, the medications cost some money. So we end up with about 10 to 12 million for the beginning. Again, the subsequent years, you spend about 100,000 per month, 1.2 per year. In every cycle, about 1-2 of the pregnancies we get per month are from cryopreserved sperms. Yes. The uptake of the eggs are still a bit less. We need to do a lot of advocacy. And I believe very strongly the women will be the biggest beneficiaries, because for them, they have a biological clock. There is a beginning and the end of the reproductive life. Part of our team is allocated to follow up these donors. And we have a dedicated section, even a room where we screen these donors. So we don't just allow them to go around suffering like that. So we have some bit of segregation of the services. They don't enter the general pool. So we have somebody who can follow them even on phone. Yes. So they don't get lost in the general pool. Yes. And then donor matching for the recipients. Luckily enough, from the technical point of view, there is no rejection of sperms or eggs and embryos. But for the outcome, the offspring, we usually match features, what we call phenotypic matching. We have a concept where we know certain key features on an individual, and those define the person. For example, the height range, the skin complexion, the shape of the face, the shape of the ears. So we match all those, and we even score them objectively. And so somebody must be very close to their donor to be able to use the donor eggs or sperms.
Thank you very much, Dr. Gonzaga and Andabati, for your time.